Welcome again. You all are joining us for Health Equity in Practice, Foundations for Sexual Violence Prevention. This is session 1 in a 5-part series on how social justice issues connect to our work to prevent sexual violence. Prevent Connect is a national project of Valor US, and NSVRC is a national project, the Pennsylvania Coalition Against Rape. Sponsored by the U.S. Centers for Disease Control and Prevention, the views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, Valor, or PCAR.
Thank you.
All right, so as I said, am I passing it to you, Janae?
Yes, you are. Yeah, thank you, Ashley, so much. And I would love to welcome Jen from NSVRC to unmute herself and give a little welcome from their side.
Thanks so much, Janae and Ashley. So I am Jen Grove. Hi, everyone. She, her. I am the prevention director with the National Sexual Violence Resource Center, and we are a hub for information and resources on preventing and responding to sexual violence. I hope many of you have heard of us. We are so happy to sponsor this series with support from our cooperative agreement from the CDC, and we're always, always, always grateful to partner with Prevent Connect. And so we heard a lot from preventionists around the country. How do we actualize health equity concepts in our work? What does that actually look like? And so we really, we met with Prevent Connect, and we really wanted to create this space for these conversations and have opportunities to hear and learn from our colleagues. And so we're really grateful to the presenters who are sharing their expertise with us today. And we're just really excited to be here with all of you. So thank you.
Thank you so much, Jen. Really appreciate it. As we mentioned, this is the first in a 5-part web conference series. We'll tell you a little bit more about that at the end of the web conference, but you can also head to preventconnect.org for more information on that web conference series. We'll send out a list of all of our links, including more information on the series after the web conference. We did just release registration for the second part in our series, Why Anti-Racism is an Integral Part of Sexual Violence Prevention. We're so honored to be working with the Ohio Alliance to End Sexual Violence for that web conference series. It will be on Wednesday, August 9th at this time. So you can register now at preventconnect.org. So today with you all, we are hoping to gain deeper understanding of how social justice movements like racial justice and LGBTQIA+ justice intersect with the anti-sexual violence movement. We'll build foundational knowledge around health equity and sexual violence prevention and describe core benefits and strategies of how to integrate social justice frameworks into sexual violence prevention. Most of our time is going to be spent on our incredible panel, so I'm really excited to bring them on very soon, but I am going to be doing some really foundational framing of health equity for you all. When we were dreaming up this web conference, we were talking about what it would be like to onboard someone onto health equity and anti-oppression, the same way that we're onboarded onto how to do our timesheets, how to give a classroom presentation. So some of this information might be review for some of you, although I always find myself learning new things every time I watch a foundational web conference. And for others, I welcome you into this space and welcome to your journey in health equity. It is a journey. So what is health equity? Health equity is kind of a buzzword in our movement. It's gaining a lot of traction thanks in large part to a really strong investment from the CDC. It's also kind of a big term. It's a little confusing, and it seems like different people are using different words at different levels. So health equity is really kind of at that macro level right now. Other people might be using anti-oppression work. They might be using intersectional work, trauma-informed work. And while there are differences in those terms, we're really focusing on the core root of it rather than definitions. But a foundational definition to provide with you all, health equity just means that everyone has a fair and just opportunity to attain their full health potential, and that no one is disadvantaged, excluded, or dismissed from achieving this potential. This is from Prevention Institute in a recent publication, A Health Equity Approach to Preventing Sexual Violence. Now, most people that I encounter are not overtly opposed to this statement, right? Sure, all people deserve to live their best full lives. Absolutely. As preventionists, we are tasked with grappling with why some people do not have access to their full health potential. And when I talk about health, I'm not just talking about physical health, although we know that adverse childhood experiences does contribute and impact physical health. I'm also talking about our social health and mobility, our emotional health, and how we move throughout the world. So, like I said, we know that not everyone has access to achieve their full health potential for a lot of reasons. And we'd love to hear from you all. What are some of those examples? What are some examples of social issues that impact people's health or quality of life? These are things that you might see walking down the street, that you might see in the news, that make it easier for some people to move through the world than others. Environmental racism from Abby. Yes, absolutely. Oh my gosh, so much. Education, poverty, racism, air quality, sexual orientation, food accessibility, lack of education, sex ed, poverty, economic inequality, privilege, lack of access to safe and affordable housing, language barriers, access to food, access to insurance. Yes, you are all on it. Please keep bringing those in the chat. I love it. And you know, we see those every day, right? And sexual violence is one of those things. As preventionists, we get to think about, as we imagine a world free of violence, what would it take to get rid of those things? What would it take to create a world where those things don't exist? Today, people do not all have the same opportunity to attain their full health and potential. It sounds like many of you understand that in the chat. There are lots of reasons that people don't have access, starting with harmful biases and stereotypes. Our beliefs and our cultural beliefs and biases about people, usually non-white cisgender people. They also don't have access to the same opportunity because of unfair policies and systems. I saw the educational system, our policing system, our housing system. There are so many things that benefit some groups that don't benefit others. So then when we kind of go above that, why do those things exist in the first place? Historical precedents, right? I mean, things like slavery. Slavery doesn't exist today, but the impacts of slavery still do. And slavery does exist in our prison industrial complex, right? There are things about slavery that are still alive and thriving and impact people today, even though that has not been legal for a long time. And above all of that, oppression. When we talk about oppression, that's another one of those big buzzwords, right? I hear it thrown out a lot. And I think most of the time, if you ask me what is oppression, I'm like, okay, I know that. How do I say that? Like, it's hard to connect with that. So we're going to spend a little bit of time talking about oppression, what that looks like, and how it relates to those social issues that we all talked about. I think it's just taking just a minute to move the slide. Okay, so oppression. When I'm talking about oppression, what I'm really talking about is racism, prejudice and discrimination against non-white people, sexism, prejudice and discrimination against women and trans people, non-men, ableism, prejudice and discrimination against people with physical and cognitive disabilities, ageism, discrimination against youth. Yes, Jen, it's going to move through and show the rest of the slide. Ageism, discrimination against youth and elderly people, classism, discrimination against poor people, and heterosexism, discrimination against LGBTQ people. We call these systems of oppression because they were created to serve a purpose, right? At the dawn of time, racism did not just exist. It was something that was created by people to benefit someone and to oppress someone else. These systems were created long before any of us were born. They are not our fault. It's not our fault that ableism, ageism, sexism exist in the world. However, as preventionists working toward a better tomorrow, it is our responsibility to address them. I said that systems of oppression are created to benefit someone. Who are they created to benefit? Largely white people, especially during colonization. So when we talk about white supremacy and we talk about anti-oppression, yeah, Virginia, cis hetero white men, when we talk about anti-oppression, we have to zoom out and think like, what is at the top of all of this feeding into everything? And for us, that's white supremacy, which is the belief that white people constitute a superior race and should therefore dominate society, typically to the exclusion or detriment of other racial and ethnic groups. Each of these systems of oppression don't impact cis hetero white men, as Virginia said. They impact other people and make it easier for white people to move throughout the world. These are the things that we learn, both consciously and unconsciously. They're the things that are embedded in our jokes that we hear when we're young, in our family belief systems, in our textbooks, in the images that we see on TV, social media, magazines, on things that we see, on the ways that our world is built around us. And they impact all of us, whether we want them to or not. It was we grow up learning these things. So if you take it to the next level, which we'll get there with this fun animation. There we go. Okay, so what happens when we have systems of oppression? What do systems of oppression do? They create our environments. What we learn impacts how we live. Because of racism, we have income. Some people have access to better income and more economic mobility. Racism impacts our housing policies, impacts the way that housing is set up. Sexism impacts working life conditions, social inclusion, and non-discrimination. Ableism impacts job security. Who has access to job security? Who has access to healthcare? Classism impacts food security and education. Heterosexism impacts what it's like to be a kid growing up in the world and our environmental cultures. And you'll see all of these arrows kind of moving all over the place. And that means that a lot of these pieces of our environments, these are called social determinants of health in the public health speak, are impacted by not just one, but multiple systems of oppression. These are the things that are happening underneath the surface, the things that we might not see and recognize, right? When I'm walking down the street, I might not say, oh, that's ageism right there, but I will see the thing that's created from it. And those are our outcomes. So because what we learn and what we live exists, what we see happens. We see things like police brutality, poverty, sexual violence, housing insecurity, pay inequity, domestic violence, harassment and discrimination, gentrification, housing insecurity, our prison industrial complex, our wealth distribution, and all of the social issues that were put in the chat because our environments exist. Our environments exist because of systems of oppression, and systems of oppression were created because of white supremacy. Right? So I can take sexual violence out of this bottom outcome, but the arrows are still there. It's gonna happen anyways. And that's something that we saw when the Me Too movement went viral a few years ago, right? We saw people grappling with perpetrators and this idea that people are born bad. Yes, Virginia, we would love to share it with you. We just made this, so we will be releasing it in a couple of weeks. But we saw people pulling perpetrators out of positions of power, right? And they thought that that would fix everything. But many of us in sexual violence prevention knew that when you take a perpetrator out, another abuser will step into their place because we haven't addressed why they became abusers in the first place. A couple of other really great ways to visualize this system of what we see versus what we don't see are the iceberg and the roots of violence tree. And, this is why it can be really hard to get people on board with grappling the things that happen under the surface, our environment's system of oppression and white supremacy. And that's because we don't see them. We can't touch them. We don't see them on the news. What we see are the causes, or what we see are the events. So with the iceberg framework, and we will send out all of these too, we did not make these, other incredibly talented people did. We see the events. That's what we can see on top of the surface. What we don't see is everything that made the iceberg underneath, right? Just chopping off the top doesn't make the iceberg go away. We might see the events, but we don't see the patterns, trends, underlying structures, and mental modes. And the same thing goes with the roots of violence tree. So this is a really great example that was created by Garth Walker, and he used the iceberg to really bring into context what happened with all of the protests after the murder of George Floyd, right? So this is what we were talking about with the iceberg. What was the event that we saw and reacted to? The murder of George Floyd. There was a huge mobilization around Black lives after that to address police brutality. And yeah, we moved the needle a little bit, but police brutality still exists now. And why is that? Well, that's because there's a long history of stuff that happened leading up to the murder of George Floyd. George Floyd was also not the first Black person to be killed by police. We need to be addressing what the US government didn't improve for decades, like no universal health care, starvation wages, mass incarceration, racist politicians, racist justice systems, no reparations, and no access to affordable education. As preventionists, we have the framework to address why all of those things exist in the first place. So why don't we have universal health care, no reparations, no access to affordable education? Those are because of the conditions. What created the iceberg? Cold water. Those are the systems of oppression. If we don't have cold water, an iceberg doesn't form. But then we have to take it a step further. Why is the water cold? Because the climate is cold enough to create cold water, the climate being white supremacy. We have to change the climate in order to get rid of the iceberg. This is like a fun, sneak peek. I'm very into this. I will just start explaining it now. So you saw, there we go, the roots of violence tree. So this is another way of helping people understand what's happening beneath the surface. So with the roots of violence tree, we see sexual violence as the leaves. The 1980s, I love, thank you, the video effect. So what happens when you walk up to a tree and you pluck a leaf? Another leaf grows back in its place. You can spend your whole day plucking leaves down, and there are always going to be leaves coming back. So you have to step back and look at the tree as a whole. Where are the leaves coming from? You might zoom out a little bit further and see the trunk. So if sexual violence are our trees, why does sexual violence exist? Because people have an abused power over others, especially women and women of color. We know that that is the problem. Why is the problem? Why does the problem exist? We say so many times that we want to work ourselves out of a job, and we have not done a great job at that. My bills are grateful that I have a job. I can find another job. My mission is to address the problem. And how do we address the problem? By addressing the causes. People have an abused power because of racism, ableism, classism, sexism, and heterosexism. And how do we address all of those roots? We have to address the conditions that allowed those roots to grow, that allowed the tree to happen. So in this situation, the soil, the conditions, is white supremacy. That's what we should be working to address when we talk about preventing violence before it ever has the chance to occur. We're doing the slide switching. There we go. A health equity approach to preventing sexual violence means that we need both to understand and address the factors that contribute to violence and safety and factors that expose some communities, especially communities that have been historically oppressed, to higher rates of violence, so non-cisgender white people. Our approaches need to address that some people have more access than others. So when we talk about equality, that's evenly distributed tools and assistance, but it doesn't take into account that some people started with more tools. If I have 5 spoons and my neighbor has 10 spoons and you give us both 5 spoons, then at the end of the day, I have 5 and they have 15. That's where equity comes in. These are custom tools to identify and address inequality, that someone could notice that I have 5, my neighbor has 10, so they get 5 and I get 10, and we both get 15. And that's good for now while we work toward a system where we both get 10 spoons. That's fixing the system to offer equal access to both tools and opportunities. That's where we want to go. We need to be doing equity while we get there. In our work to prevent gender-based violence, we share a vision for a world where individuals, families, and communities thrive. I feel so lucky. When I started learning about anti-oppression, I was like, oh, I don't have to just work in sexual violence. Like, the things that I do could actually impact economic stability. They could impact racism. They could impact our environment. How lucky for me. Also, it makes my job really hard and really big, but what a wonderful place to be in, to have a vision for a better world and to work toward that. This means that health equity is our work. If we are only addressing sexual violence will never go away. And with that, I am really excited to turn it over to our incredible panel of speakers who have so much more to share on this than I ever could, starting with Ariana Sessoms, who uses she, her pronouns. Ariana is a member of the Culture Change team at the Virginia Sexual and Domestic Violence Action Alliance. Her role involves delivering training, technical assistance, and resources to professionals who serve survivors of sexual and domestic violence in communities across Virginia. Prior to entering nonprofits, Ariana worked in higher education, developing and implementing violence prevention programming, providing confidential advocacy services, and teaching. She is a preventionist at heart, passionate about changing conditions that cultivate and perpetuate harm. She advocates for social justice, promotes joyful sexuality and relationships, and strives to build collaborative partnerships across organizations and communities. Our second panelist joining us today is Darren J. Dorsey, who uses he, him pronouns. Darren is the principal and co-founder of Rooting Movements, a consulting firm that helps organizations ensure that the values that underlie the change they intend to make in society are reflected in how they operate. Rooting Movements provides workshops on the topics of racial equity, movement building, and intersectional approaches to gender-based violence prevention. They also help organizations assess their practices, policies, and culture to ensure that their values are reflected in how they operate. Darren has 15 years of experience implementing gender-based violence prevention, including as a prevention educator, policy advocate, and RPE technical assistance and training provider. He works in community with the amazing advocates and activists he has had the privilege to connect with over the years, and believes consultation and training work is more effective when done in collaboration with other movement workers. Our third panelist is Jessica Adel, who uses she, her pronouns and is an evaluator and program director for the Michigan Coalition to End Domestic and Sexual Violence. As Michigan's catalyst for creating empowered and transformed communities, MCEDSV's mission is to develop and promote comprehensive efforts aimed at eliminating all forms of domestic violence, sexual violence, and human trafficking. In addition to evaluating prevention efforts, Jessica provides training and technical assistance on a variety of topics relating to domestic and sexual violence, anti-oppression, prevention strategies, advocacy, trauma-informed care, and disability. She brings over 20 years of experience in a variety of roles, including serving as the executive director of 2 of Michigan's domestic violence service agencies, university-level teaching and academic research, and post-assault crisis response. Jessica is passionate about creating communities where all individuals thrive and belong, promoting healthy and fulfilling sexuality and anything related to food, nature, travel, health, and healing. And our last panelist we're so excited to join us today is Emil Rudisell, who uses they, them pronouns. Emil is a project coordinator with Forge. They're from North Florida, and they've been a community organizer and activist in a broad range of overlapping movements with a focus on anti-violence movements, reproductive justice, and youth leadership. Emil brings over 20 years of experience working in direct service, providing crisis intervention and peer counseling. Emil joined Forge after 7 years of statewide work preventing and responding to domestic violence through supporting service providers with training and technical assistance. They dream of a world without violence, with communities that take care of each other and have the support everyone needs. Outside of work, Emil loves the ocean and all of the weird, fantastic nature of the land around them. Thank you all so much. We're so excited to have you. Ashley, if you could stop sharing screen and we can spotlight our panelists, we will get started on our questions. How are you all this morning? We're so excited to have you. I think we are just looking for Jessica. There we go. Okay, welcome everyone. Thank you so much. So let's just jump right in to the conversation. I know we don't have you for as much time. I wish we had you all day, but let's just jump right in. How do you understand the connection between sexual violence and oppression?
Hi, y'all. I'm happy to jump in because you were talking a little bit earlier about the definition of oppression, and I heard someone at a training say this once, that they defined oppression as a perpetual state of disadvantage. And I really liked that because it's not this thing that you can pull yourself up by your bootstraps. It's historic, it's systemic, it's ingrained in our institutions, in our cultures, and it can be traumatic for folks. And one thing that I often talk about with folks is that oppression is perpetuated by the belief that we want power over versus power shared. And when we think about oppression of people with marginalized identities, racism, sexism, all of that, that it's this idea that people of a dominant identity have power and deserve that power and can hold that power while rendering others powerless. And sexual violence works the same way. On an individual level, you have someone who's trying to take power from someone or exert power over them and render them powerless. So we see our systems are a macrocosm, if that's a word, I'm unsure, I made it up, but it's a macrocosm of the smaller individual interpersonal experiences that we have. And I think also vice versa. We see how the state treats us and allows us to be treated, and then we take that into our own relationships. So I really like to look at that connection between violence and oppression on a large scale and sexual violence on somewhat of a more interpersonal scale, and how that's connected, and how we see power and sexual violence used against marginalized folks when you're talking about slavery, when talking about colonization and thinking about war, how sexual violence is used as a tool of oppression, used to take power from folks to make them sort of submissive when trying to get them to do a certain thing or stay in a certain place. So I think that's a really important connection, is looking at how violence is used as a tool, but it's also that microcosm of how we're being treated on a larger scale, especially for folks who have identities that are deemed invaluable to those who have had power.
Thank you so much, Ariana. I think that analysis very much aligns with my understanding as well. And I think that piece around sexual violence as a tool for oppression is really, really important. When I began doing this work, the framework that I sort of was introduced to was very much around sexual violence as an outcome of systems of oppression. And understanding that it can be both an outcome and a tool is so incredibly important and lends itself to an intersectional analysis. In a lot of my work on anti-oppression, one of the things that I do along with my colleagues is to look at history to understand how that happens. And so a text or a resource that we use quite a bit is Thomas A. Foster's Rethinking Rufus, which is a book, probably the only one of its kind, on sexual violence against enslaved Black men. And it specifically talks about the ways that Black men experienced sexual violence during enslavement and how white women perpetuated that violence to maintain their power and control. And so we utilize that example as a way for us to better understand how sexual violence is not always the outcome, but can be a part of the system of oppression to maintain that domination, to maintain that control. Sort of similar or adjacent piece of history is around violence against Indigenous peoples. Martha Bono is a researcher who has talked about how violence was used against Indigenous communities, and I think in particular the Cherokee Society, and how not only did white settlers come in and inflict this colonial violence in itself, but also how that violence was used to reorganize that society, how that violence was used to end at an outcome where gender roles in the Cherokee Society shifted, where power between genders, various genders, shifted as a result of the sexual violence that happens. And so I think that is a really, really helpful tool for us to understand how sexual violence interplays with other types of oppression. And I think it also reminds us that in the context of attacks on Black history in the United States of America that are happening right now, our organizations, our movement has a role to play in ensuring that some of the history that we're talking about now doesn't get erased. Because when I think about, again, when I was introduced to this field, if the folks that I worked with had this understanding when they were in school, they were learning about not only the limited stories that we receive about the period of enslavement, but the broader ways that happened, then we would have had a more intersectional analysis. And so that history is really, really, really important for us to look back at to better understand how violence happens and how we can prevent violence. And again, really emphasizes that we need to be at those school boards. We need to be at those libraries, ensuring that this history doesn't get erased.
Thank you so much. That's really helpful and such an important context as we move through our conversation together. I'm really curious for each of you, how can you tell us a little bit about your own journey to root yourself in your work in health equity and what that's been like? Because we don't just come into this like knowing all of the things.
Yeah, I can get started. We were talking about this all yesterday, is that I don't use the word health equity in our work. It's not relatable to so many folks and people, and building connection and community is really important to the work that we do. So using language that that makes sense for us and those communities is really important. And I think it's also useful for us to understand the history of like the public health field and industry, and the racist and sexist history that that's founded on too. And I think language is awesome and cool, and it's really great when we come up with new words to describe things that help us talk to each other. But just being thoughtful about where they help and where they hold us back. But in terms of like journey, also, for me, the connections between all these different movements that people have named has been a really important part of like my life and learning, and seeing how when I worked on an abortion funding frontline, callers had like, yes, they needed money for an abortion, and domestic violence, sexual violence, transportation, housing, climate change, healthcare, education, like every single issue is impacting people's lives. And so we, to provide this service, we need to understand all of these connections. And the same is true in the domestic and sexual violence world. And really meaningful to me has been like abolition movements and disability justice movements. And what abolition has helped me learn is like tear down the things that are hurting people, but at the same time build up the things that create safety, connection, and community. And disability justice also really speaks to like take care of all of us, and that we have value and dignity and worth outside of productivity, outside of capitalism. So I lift up those as like.
Hi, everyone. So, Emil, when I heard you yesterday and now talking about how you don't use the word health equity, I got excited about that. So when I think about my journey through like understanding health equity and how it relates to sexual violence, I started on the opposite end of that spectrum, where these, like a lot of the terms that these buzzwords that we throw out, I wanted to really like master these terms and really understand them. And so I invested a lot of time in being able to have them roll off my tongue and use them in spaces and sound really smart. And as I moved through that, it became apparent that, when we use buzzwords, a lot of times we're using the same word, but we're talking about very different things, or we have different understandings of them. And that can unintentionally cause harm to people, and it can exclude people. So if we're only talking in like this specialized terminology that professional preventionists or healthcare, the healthcare sector use, we can exclude folks because we're having conversations that other people don't have access to. So I started this thinking, I want to learn these things to give myself access to spaces. But I missed the point that the flip side of that is lack of access is also exclusion. So at some point, all of us had to learn these. We just, Janae, you just showed a slide of the definition of health equity 15, 20 minutes ago. But are we all understanding it in the same way? And if we're not, we're being exclusionary. And so when we do that, we are, we're sitting in spaces and we're talking about communities rather, and I use that word about very intentionally because we're talking about them rather than dialoguing with them, right? And dialoguing with them and learning from communities is how we learn how to actually do the work and understand the issue and the problem from their experiences, not from the more academic way that we learn it. And then I also think, when we focus on like the jargon, the buzzwords, we can get stuck in the stage of just naming. And I don't want to devalue, like naming something has power, but it's the first step, right? And so it can hinder us from engaging in real dialogue with communities and then moving into the steps of taking action, right? We talk about health equity all the time, but what are we going to do about it? How are we going to help communities and folks who have power to make changes about the conditions that are like disallowing folks from being as healthy as they want to be, right? When a few minutes ago, when you were showing the slides on the iceberg and the tree, all of those underlying factors that get in the way of equity of health equity and folks being able to be as healthy as they want to be, those are things that are created, and they're created intentionally. The empowering thing about that is because they're created, they can also be changed. And that's how we can empower ourselves and empower communities to start making that change. So I have also, I say fairly recently, in like the length of time I've been doing this work, fairly recently also moving away from using the buzzwords. Even though I finally feel like I mastered them and can use them appropriately, I'm trying not to use them anymore. Because they're getting in the way of real dialogue and getting in the way of like empowering communities to make those changes.
Thank you so much for that. I often think when I am in spaces and I don't understand what people are talking about and what it means, then the communities that it impacts, they're definitely not going to understand, right? Like I think a lot of us, and that's part of it coming from a professionalized movement, the answer is, well, then I just have to fit into the box. I have to learn and conform to those things. But you're right. It's not about health equity. It's about what we're going to do. And on the note of what we're going to do, for us to understand what we're going to do within health equity and advancing equity in any sense, we have to understand the ways that our world is set up, our systems are set up to either support or, in a lot of cases, harm people. So again, when I'm talking about systems, I'm talking about things like our housing policies, cultures and beliefs, policing, and education, the things that go beyond individual person-to-person interactions. What kinds of systems contribute to sexual and intimate partner violence, and what does that look like in real life?
So I think one system that I feel like many folks in our work avoid talking about sometimes is the criminal justice system and the carceral state. Because of course we all want accountability for people who are harmed, but we also have to recognize that prisons don't stop harm, they perpetuate it. And it's so difficult to have that conversation because we know that many survivors want to never see their abusers again, and they deserve that, full stop. And we know there are survivors who truly just want the harm to stop. They don't want that person to be imprisoned or for their communities or their families to be torn apart. And we know that many survivors want the person who harmed them, the only thing they want is for them to not harm anyone else. But we also know that even after they report or arrests are made or people are incarcerated, harm will continue, and those people may continue to cause harm throughout their life because that root cause of the perpetration wasn't addressed. So it's hard to grapple with a lot of that. And we know that a lot of sexual assault cases don't even get to the point of incarceration because the system is set up against survivors. They're not believed, they're not taken seriously, they're told it's their word against the other person's, or told there's not enough evidence, or they don't report at all because all the ways in which the systems harm different people and all the trauma that can come just exclusively from getting involved in the criminal justice system and telling your story over and over again. And on top of all that, we know that via the history of the criminal justice system, that it was designed specifically to protect certain people and not others. It was not designed to protect people of color. It was not designed to protect people with disabilities. And we know the disproportionate rate at which Black and Brown children and adults are filtered through the system. So when we know that, we also know that generally just doesn't have desirable outcomes in the carceral system. And we know that when people are put in prisons, they experience incredibly high rates of sexual violence while they are incarcerated. So wanting to think about how do we move past our reliance on that system, because putting people in prisons doesn't stop violence, it continues it. And it doesn't stop sexual violence, it really creates more. So I'd really love to just continue having that conversation, really thinking about how do we envision accountability and restitution and justice in a way that doesn't continue violence and in a way that meets everyone's needs without just further contributing to the problem.
Yeah, and I think a system that I think I would love to bring to this conversation is the system of capitalism, which often plays out in workplaces. Again, I think it's important. We can learn a lot about this through history. And I know it may sound like I'm like name dropping people who have done a lot of this work, but I really I do that for a reason, which is to say that, one, this isn't all stuff that I came up with. And it takes a community for us to learn these things and understand them. And so a couple of historians, Caitlin Rosenthal and Matthew Desmond, who's featured in the 1619 Project, have done some work to look at plantations and to look at how they operated, and then to make connections to workplaces in America, and to make connections on how some of the systems and processes that were in place in plantations made their way into workplaces, into the Industrial Revolution, into other periods of American capitalism. And so you can see this in a lot of our organizations and how they operate. And a lot of those approaches then made their way into our organizations. And so one thing I often talk about is the fact that in a lot of organizations, in a lot of companies, one value that will be in place is that, say, for example, you do sales. If you hire someone, one thing that's kind of inherent to the business model is that you want to ensure that you don't invest more in that employee than they return back to you. And so when we take these processes and these approaches and we put them on our organizations, and we place them within the context of how we do our work in environments where that doesn't make any sense, we see systems of oppression maintain themselves, and we see inequities in the workplace. And so it's really, really important for us to question sort of the default assumptions of how we should do our work and how that contributes to capitalism, which in itself furthers other systems of oppression like patriarchy, like white supremacy. And so a lot of our organizations can do some of that work to take a look at, hey, why do we have this policy in place? Why do we approach our work in this way? We can even look at, I think, the conversation that we've been having around terminology. Why do we come up with a new buzzword every 5 years? And how is that maybe connected to the need in other industries to create new products to profit? And is that the best way for us to do our work, or should we be thoughtful about that and pivot to doing it in a different way?
Oh, go ahead, Jessica. Yeah.
I just want to add one thing. So Darren, I love that you kind of ended with that introspection and like looking at ourselves, because I think one of the things that folks, all of us involved in this movement, sometimes forget is that we are also a system. Like, we are also a system that survivors engage with, and we can and we do harm survivors. Our movement, our shelter system, our organizations are also rooted in white supremacy and capitalism. And so when we look at like who we're really good at serving or better at serving, who we are not serving in like culturally humble ways, and who's being totally excluded from our services, we also cause harm. And so I really like to center that looking inward and also being really critical about ourselves. We do a lot of good work. We're also a system that cause harm. And we see this in some of our outcomes. We see that in a lot of our organizations, we are serving, unless it's culturally specific, we're serving predominantly like white, cis, female identified survivors, right? And Black and Indigenous survivors, if they're coming to shelter, are staying a couple of days, like 2 to 7 days, and they're leaving. These are outcomes of us being a system and also causing harm.
Wow, thank you so much for sharing that, both Darren and Jessica. I'm curious, I heard you, Darren, and I completely agree. We say our organizations need to look at, why are we causing harm? Why are these things happening? And I think I have seen a lot of times people who are new to this work ask, okay, what does a real life example of that look like? How do I ask why? What do I do about the why? So I'm curious for you all, how do we confront those things? What are some examples of what addressing the why looks like in real life as an individual or an organization?
I mean, I think very literally saying why can be helpful, especially on the organization front. Um, talking to your boss, talking to your coworkers, why? Tell me about the history of this. Where did this come from? And being able to ask that of yourself too. And then on the bigger question of like, how do we confront systems? For me, what's been important is the feeling like we can make change. And that's been really hard for myself and most people I know in the past many years. And one thing, an example, a visual that's been helpful for me came from organizers fighting against dictatorships. And often we think of dictatorships as this entrenched power that's impossible to topple. And oftentimes, power is visualized as a triangle with a small group on the top and everybody else is underneath. But actually, power systems are really unstable. And so if you think of it as an upside down triangle, a dictatorship's not stable. Violence isn't stable. It has to be propped up by a bunch of different things. So I don't have enough hands for this, but you take that upside down triangle and you got sticks that are holding it in place so it doesn't topple over. What are those sticks? Those are the things we've been talking about. The systems of oppression, barriers to getting housing, barriers to healthcare, capitalism, everything else. And then you can start to focus in. And toppling dictatorships, people have done stuff like work with the media or try and get the police to not hurt protesters so that protesters can actually do their work effectively. And so taking that visual and applying it to sexual violence and then applying it to systems of oppression has been really helpful to think about what are these props and then how can we take props down? And there's so many of us, there's hundreds of us on this webinar. We all have different things that we're good at, different places that we can take in. And so that helps me feel like stuff is possible. And I really appreciate, I think everyone's highlighted this, remembering those things were created by people. Policies were created by people, which means people can create different policies. Culture is what we learn from each other. It's stuff we uphold. Yes, it's in the air, but we also have a role in reinforcing and creating it. So we have a role in creating something different. That's the abstract. I can talk about the concrete, but I want to let other people talk too.
I'll try to be brief, but I just want to make the point that folks don't have to start at zero when it comes to asking why and analyzing, what we're doing and why we do it. A lot of folks have asked those questions and put their thoughts out there. And that's where I start, is learning from other folks who have been in this movement, who have done similar work and have asked these questions. And so I'd point people to Social Service or Social Change by Paul Kivel that really dives into our work and whether or not we're perpetuating a system or whether or not we're creating fundamental social change. The Braid That Binds Us is an article that dives into the professionalization and neoliberalization of the domestic violence field. Miriam Kaba's put out a number of resources, including an analysis of the Santa Cruz Women Against Rape's letter to the field that cautioned the field in investing in the criminal justice system. And so we can look back, we can learn a lot from other people who have asked these questions, and then we can build on that, and then we can engage with that and go from there. We don't necessarily have to just kind of sit within our organizations and say, hey, why are we doing this? Why are we doing that? Because other folks may have asked that question.
I love that. Thank you. You're right. Yeah. There's so much expertise that already exists. And we put this in the chat. Ashley dropped a link to the Braids That Bind Us, and we will be sending out a follow-up document with links to all of the resources that you all have mentioned for folks to continue their learning. Something else that I have seen in local organizations, especially, but I think at every level of sexual violence intervention and prevention, is this idea that we exist outside of oppression. We exist regardless of oppression, and that our role ends there. You know, I often hear people say, and it's on their websites and it's in their missions, that we serve survivors regardless of their identities. And then stopping there. And as a staff saying, that's enough. We are not racist. There, we serve anyone. Therefore, we don't need to do anything else. And I think that that is well-meaning, but it also misses some really key points. So for you all, why isn't serving survivors regardless of their identities enough?
I mean, I think kind of simply, we can't treat people equally when we don't live in an equal society. And I think a lot of times when we're thinking about who we're serving and someone comes in with a need that we can't meet, we see that person as a burden. And that I think goes against everything that we really stand for. And so I think it's important to incorporate in our work that we are embracing people's identities and their experiences and their journeys, and that we're finding ways to be accessible from the get-go, rather than trying to figure out along the way how to accommodate people, or just saying, actually, no, we can't do that, and turning people away. And I know there's so many barriers for the work that we do to try and make that happen, but that's also the roots of this work. The roots of this work was in communities where people didn't have resources, but they were still there to support one another and to advocate for each other. And so like many of my other panelists have shared, thinking sort of back to those roots and making sure that we're already incorporating people's needs from the beginning, thinking about language justice, thinking about disability justice from the get-go versus, oh, we forgot about that, so we have to incorporate that later. And I think that's where a lot of us are. And I know I've made those mistakes all throughout my journey, as I've learned, as I've become better at doing this work and recognizing the roots, is knowing how do we make sure that we're serving everybody immediately and not just serving who's, quote, easiest to serve, and seeing other folks as, oh, that's an extra step.
Thank you so much. How do we move beyond that framing if we are at an organization that has historically existed in the we serve regardless arena?
I think what Ariana said about community is so important here. And there's been really amazing work around how community and culture helps us heal. So if you're at an organization that's more on the intervention response side, you're thinking about how connecting with our communities, with our cultures in ways that are positive and healing can be so good for survivors. And on any side, bringing it up, what's missing from this? We're not serving everybody. And I think it involves often being bold for when it's safe to do so. I know we're all also navigating a lot of things. It's often the frontline workers who are the lowest paid, who are the ones who are noticing the inequities the most. So supporting each other, having each other's backs. When you're talking to your coworkers and they point out something, you'll listen to them and acknowledge it too. That helps us to build, stronger connections that can make change at higher levels.
I'll also add super quickly, because I feel like this is always a passion of mine, is thinking about who we're hiring at our agencies and how so many organizations will have if I'm being frank, just white women who are working at them, even though your community is diverse with different people. So really thinking about who you're hiring, who you're extending jobs to, and even what your job postings say, because the language that you use, the images that you use may attract certain people versus others, or may turn off certain folks. And I could go on thinking about the salaries that we're posting and, do they actually meet the needs of people in that community? Could they actually afford to apply for this job, et cetera? So I think our hiring practices are super important in this work, because if we don't have a staff that represents our community, where things are going to fall through the cracks and we're not going to be able to serve everyone like we should.
Yes, I 100% agree. I think the hiring and staff makeup is a key component. And I think part of that is, what competencies are we looking for and what are we highlighting? Because I've worked in a lot of organizations where if somebody comes in and into an interview and says, hey, I don't understand why domestic violence survivors don't just leave, or I don't understand why survivors of sexual violence are wearing that, et cetera, then we don't hire them for good reason, because they don't have a competency there. However, when it comes to issues of oppression, when it comes to issues of understanding racism, of understanding microaggressions, of understanding gender and gender identity, I often see organizations say, hey, they can grow into that. We can learn them, and allowing a lot of grace around that. And it's really important that we have high standards around understandings of anti-oppression. Not to say that there's not room to grow, because there's room to grow for everyone. But what ends up happening when we do sort of put that to the side is that then our staff of marginalized identities are then the sort of casualty of that process of learning. And so then we see that we're not retaining our staff. Then we see that staff with marginalized identities don't feel safe. And so it's really, really important that we support all of our staff in maintaining a high competency when it comes to anti-oppression related topics, and that we have a bar that allows us to ensure that we're creating a safe workplace for people with marginalized identities as well.
Wow, that shook me for a moment, that we will turn someone away for saying, why were they wearing that, or why don't they just leave? But we will still hire someone who doesn't understand oppression. And are we committed to actually teaching them that in and of itself from the get-go says, I care about this more than this? That is so powerful. Thank you both. Thank you all three of you for sharing. One of the reasons that we're putting this web conference series together is to address some of the onboarding gaps that exist in the movement to end sexual violence, and really a lot of social justice professions. I would love for you all to think back to a time when you first started in the anti-violence movement. If you could go back in time to that moment and speak to a younger you, what advice would you give about how to do prevention work in an impactful and equitable way?
So I have lots of advice. I'm going to keep it to two and try to keep my storytelling short. The first piece is to really prioritize relationships and real relationships and connection. That is it's the core of prevention work. It sounds really simple to say, but I think to actually do it, at least me personally, I struggled in the beginning, and it's been a journey for me. When I first started doing prevention work, I came in at the beginning of a large 5-year prevention initiative. And so we were spending the first amount of time building relationships, and identifying partnerships. And what that looked like was having lots of coffee and lunches and sitting down with communities and having communities literally like walk us through their neighborhoods and show us where they live, work, play. we spent a lot of time doing that. That is so important. At the time, however, I didn't get it. So I tend to move fast. I'm agenda driven. I'm moving away from this now, but in the beginning, super agenda driven. So I'd sit down for a meeting. I'm like, let's chit chat for a few minutes. Then let's hit this agenda. We have 60 minutes. 2 hours later, we're having coffee. So in that first year, we spent that's how we spent the time. And then I started feeling anxiety about that. And I'm like, we got to start working. We got to start doing the actual work. We have so many deliverables in this project. Then COVID hit and seemingly the world stopped. We had to completely pivot what we did. The thing that allowed that to still be successful and for us to be able to do that work was all of the time invested in the relationships up front. That made it happen. And it took a reframing for me to understand that time that I felt was being wasted, that was the magic, right? And so my advice now is like, make time to have the damn coffee. That is the most important first step. My second piece of advice is like, step into the braver spaces, share your different perspective, and don't stay comfortable. So right now in Michigan, we're changing, we're pivoting the way that we're doing the work. So this started, I don't know, maybe 6 months back. We're having the same conversations all the time. How can we expand knowledge and capacity to do more prevention in the state? How can we diversify and expand state leadership teams? So we had just gotten out of a state leadership team meeting. I felt so good about my presentation. I felt so good about the meeting. We were debriefing. All the fancy words were just flowing out of my mouth. I felt great. Then one of my colleagues stepped into that braver space, had a totally different perspective, and they said, that meeting made my skin itch. And so we started having a conversation about why that is. And talking about how, when this goes back to the what I said earlier about how a lot of times the language we use excludes people and it creates disconnection rather than connection. So I just want to give 2 quick examples. So in the earlier days when we were building the relationships, we started meeting with this neighborhood group in Detroit. Neighborhood had high crime, property vandalism, truancy, dropout, DV, no food access. I mean, you name a risk factor, it was there. They came together and formed a neighborhood group where they literally went door to door meeting people. They started with strengths, like what makes you feel good about this neighborhood? They started with strength. Then they started talking about what are the problems and what can be addressed. There were a bunch, like a group of, let's say, problem youths. Everyone in the neighborhood knew who they were. They were tagging. There was graffiti. So they brought them together and they said, you want to tag? Here's the paint, make art. They showed us the wall. It was a huge, beautiful mural. It was a work of art filled with inspiring, empowering messages. They revitalized a park. They fixed the play equipment. They started food access programs. They started running like actual community programs in this park. They started a mentorship program for those same youth, and the youth became leaders in the neighborhood. I remember thinking back and saying, well, they don't have a CCRT, a coordinated community response team. We need to get them to start talking in terms of risk and protective factors, social determinants of health. Like, we need to onboard them into the prevention world. We ended up not partnering with them. There was another group, the same colleague that said the meeting made their skin itchy, was sharing about a refugee community that they're a part of and that they work with. Similar story, a group came together within the community to name and identify what are the strengths, what are the problems, and come up with creative solutions. In this case, it was low cost access to early education and childcare. When we were having this conversation, we had literally just written a grant to do that exact same thing. And so we have started to really look inward and be critical about ourselves. Are we really doing intersectional prevention when we're excluding people? How are we deciding what is real prevention and who gets to be part of this exclusive prevention club that we have? Who matters and who doesn't? Who gets a seat at the table and who doesn't? This conversation has been really uncomfortable and it doesn't feel good. Like that kind of challenge doesn't feel good. So when I think back, I want to encourage folks who are coming to this work and tell my younger self, like, step into that braver space. If you're sitting in a room where there's consensus and you're the only one that has a radically different perspective, that is the perspective that is needed. So step into that space and share that voice. You are all worthy to be here and your perspective counts. So speak it out. And when you're standing at like the edge of that pond of discomfort, instead of taking steps back into comfortability, just jump on in, baby. Like that is where the magic happens, right? It is scary and it doesn't feel good, but that's also part of the process. And I'm sure in 15 minutes, I might even regret sharing this in this national space, right? Because it's uncomfortable. But that discomfort is where we grow, where we do better, right? So I guess the advice is like when you're feeling really comfortable and confident about the work you're doing, pat yourself on the back and celebrate, and then take that as a cue and seek out perspectives to challenge what you're doing, because it's also a sign that you need to keep moving because you're getting comfortable and that's not a space we want to stay in.
Thank you so much, Jessica. I know we only have about 10 minutes left, about 9 minutes left. So please, yeah, continue if anyone else would like to answer.
I will try and talk fast, but I wish younger me had been exposed to everyone on this panel and all of the perspectives that y'all have shared. And I want to take it back to something you mentioned earlier, Jessica, when you're saying how we talk about communities and not with them. I started this work in higher education as a grad student doing prevention work with college students. And I came into the work through an experience where I realized how many people around me were impacted by sexual violence and was like, people need to know about this. So I came in from an awareness and education perspective. I wanted to tell people about this. And when you're in an academic setting, that's really the norm, is like, I have information that you don't have, so I'm going to share it with you, which can be helpful. But I was missing so much else of this work and missing the root causes of primary prevention of all of these things and those relationship building as well. So I think I fell into sort of that idea of telling people what they need versus asking. I was a college student at the time and I was working with students. So it was easier, I think, to sort of hear what was going on and do that. But then as I moved away from that, I really started to realize, wow, we do that a lot, not just to students. We do it a lot to students and young people generally, but to communities in general. We think we know what they need rather than actually asking or using their strengths that they already have. And when we're working with survivors too, like they have already done so much to heal and to support themselves and to navigate horrible situations. And so instead of assuming we know what people need, working with them and just being there as a resource and as an advocate. So that's been a huge thing for me, is just learning more. And I continue to learn all the time from everyone I'm around. And another thing that I thought of is reading Four Pivots by Sean Ginwright, and how he talks about it's not enough to define our work by what it's in opposition to. And I think we also do that, especially when talking about anti-oppression, is we are against racism and we're against anti-LGBTQ antagonism. We're against all of these things, but then what are we for? What do we want to see our world look like? What is that vision that we have? What can we imagine where we live in a world without those things? We live in a world without prisons. We live in a world without people not being held accountable. And so that has really been helpful for me to think about not just what am I fighting, but what do I want? What am I aiming for? And so taking that with me as well.
Yeah, I think I would similarly love to show myself this this webinar this recording, because I think a lot of what's come up would have been helpful. I think there's a number of things we could do. I think a whole panel on just this question, and it would be incredible. The I think primary thing that I would tell myself would be to, again, going back to what we've already talked about, understand gender-based violence, understand sexual violence in the context of larger systems of oppression, in the context of white supremacy, and broaden my understanding there, because I think that would have allowed me to contribute more. When I came into this field, one thing I realized just a few years ago was the fact that at the first organization I worked for, folks were real quick to say, "Hey, you're the first cis man who's ever worked here. You're the first cis man that's ever volunteered here," which is great, and there are a lot of things that as a cisgender man, I need to be conscious of when I'm engaging in this work. And not a single person ever said, "You're the first Black person to ever work here." And I was. But that analysis, that perspective was not valued at the time because there wasn't an intersectional analysis. There was very much a single issue analysis that prioritized patriarchy as sort of the end all be all system of oppression. And while it can be that in certain contexts, these systems of oppression intermingle and are complex. And so I think that really would have been something that I would have wanted to help myself understand earlier. Because again, it was only a few years ago where I recognized, wow, my identity and experiences as a Black person, as a Black man, was very much erased, was very much silenced in that first organization that I worked with in San Luis Obispo, California, in a town that Black people didn't really live in an organization that didn't really serve Black people. And so I could have contributed so much had I had a broader understanding of how gender-based violence is connected to other systems of oppression.
Those are all amazing. I'll try and go quick. I have two catchphrases that I still tell myself a lot. And one is "make it gayer," which is a way for me to remind myself to just lean into who I am, especially when I'm bringing identities and experiences to a space that are not in that space. And everybody benefits when we're able to lean into these full parts of ourselves. And when I'm not trying to hide it to be professional or things like that. And then your value is not your work. I think just remembering to rest and take care of ourselves and see that we are more than a paycheck and our job and the way our bosses treat us. And that knowing that helps me to do all of the work that all of these amazing panelists have been talking about, building connection and relationship, because I'm not as scared about, oh, I have to write the perfect grant. I have to be the best grant writer. I have to be the best report. I have to whatever. It's how do I connect, really? The first catchphrase is "make it gayer," which maybe doesn't apply to everybody, but it's just a funny way for me to, remind myself, especially when I'm in cis straight spaces, I have a right to exist on this planet.
Thank you for that. Thank you all so much for sharing your experiences, your expertise, your advice. It got me turning my brain about what Prevent Connect can do to uplift advice to our younger selves and to people in the movement. We are just about up on time. So we want to thank everyone so much for being here for this web conference, for this conversation. I'm going to drop a couple of links in the chat, including where you can register for our second session. 1 second. And that is why anti-racism is an integral part of sexual violence prevention. So that registration is up live at preventconnect.org now. Ashley also put a link to a Survey Monkey in the chat. We would love your feedback on this session. I will repeat that right here. And we will be sending out a recording of this web conference along with follow-up materials in the next unspecified, but definitely soon amount of time. Thank you all so much for being here. We appreciate you. Thank you to our panelists. It was so incredible and energizing to hear you all speak. I feel like I learned a lot. It sounds like people in the chat did too. I saw a couple of this is the best panel I've ever been to, so yay. And everyone, we hope that you have an incredible day, week, and enjoy your weekend. And we will see you in part 2 of Health Equity in Practice, Foundations for Sexual Violence Prevention.